Hi everyone, I'm Maryam. In this video, we'll talk about the different types of medical imaging in a simple and easy way. First of all, why is medical imaging important? It helps us diagnose diseases accurately, which allows doctors to choose the most appropriate treatment protocol for each patient. So, what are the most common types of medical imaging? There are 5 main types: X-ray, CT computed tomography, MRI magnetic resonance imaging, ultrasound, and mammography. Now we'll talk about the first type, X-ray, which is one of the oldest and most widely used imaging techniques. So, when do we use it? First, to diagnose fractures, helps us see the severity of the fracture. It's also used in dental imaging, to check the condition of the tooth roots, nerves, and in chest problems like detecting pneumonia. And finally help in assessing spine injuries, especially after accidents. X-rays are usually the first step in diagnosis. They're fast, simple, and available in almost every hospital. The second type is CT scan. It's more advanced than a regular X-ray and gives us detailed cross-sectional images of the body. So, when do we use CT? First, chest imaging, especially when we need more detailed views, like in cases of tumors or PE. It's very important in brain imaging, especially for brain bleeding, because it detects it quickly. Also for complex fractures that can't be seen on an X-ray. And we use CT for the abdomen and pelvis in emergency cases, like appendicitis. The third type is MRI. It produces highly detailed images of the body, especially of soft tissues. So, when do we use MRI? First, joint problems and pain that need detailed soft tissue evaluation, and also in tendon tears or ligament damage. It's also essential in neurological disorders, such as MS, where we need to see changes in the brain and spinal cord. MRI is used for stroke diagnosis, especially ischemic strokes. And finally, it's used to evaluate spinal discs in cases of disc herniation or nerve compression. The fourth type is US or sonography. It uses sound waves to create real-time images without any radiation. So, when do we use US? First, abdominal pain, especially when we're checking the GB, liver, or kidneys. It's also used as a guide during interventional procedures, helping doctors place needles or drain fluid safely, and used in breast imaging, especially for evaluating abnormalities. And it plays a major role in pregnancy monitoring, like checking the baby's growth. In short, US is a safe, quick, and non-invasive imaging method. The last type is Mammo, a special kind of X-ray used to examine breast tissue. So, when do we use Mammo? First, breast screening done as a routine checkup. Also used for breast diagnosis, when we need to evaluate abnormal findings. And finally, it's used for follow-up. Mammography is a simple but powerful test that plays a key role in detecting, diagnosing, and monitoring breast conditions.